Hi, I'm Rick Walters with the Fort Wayne Smallest Winter Program. And this week we're at the Physical Medicine Consultants, and we're with Dr. Lazoff, Dr. Stensland, and Dr. Zollman. Dr. Lazoff, why is it important you guys are a part of this year's Fort Wayne Smallest Winter Program?
Well, we feel here at Physical Medicine Consultants that we want to treat the whole person, and weight reduction is part of that process. Weight and being overweight actually adds stressors to different joints of the body, back, knees and hips, and consequently that impacts patients' recovery. So from our perspective, we treat most injuries from a conservative perspective, medicines, injections, physical therapy, strengthening programs, because most injuries can get better with conservative measures and don't necessarily need surgery.
Dr. Zollman, when somebody would come to see you, how would you diagnose what their issues or what their problems might be?
Good question, Rick. So we would start with a good history and physical. So just getting information from the patient, examining the patient, coming up with a diagnosis as to what we think may be going on. And then from there we lead into testing to really try to nail the diagnosis. And that can be x-rays, MRIs, CAT scans. Sometimes we'll do injections for diagnostic purposes, put a shot in a certain area and see how the patient responds to that shot. There's a test called an EMG that we would use as well to diagnose nerve function.
Once diagnosed, Dr. Stensland, what are some of the treatment options?
At Physical Medicine Consultants, we're trying to restore function. So part of that involves restoring muscle strength and conditioning and flexibility through physical therapy programs. A lot of times it's an issue of managing pain. So trying to do that either through oral medication management, anti-inflammatories, pain medications. Sometimes we'll inject areas with anti-inflammatories such as corticosteroids to try to reduce inflammation. Ultimately, if all other options fail and the patient is left with chronic pain issues, a lot of times we'll implant devices in order to restore function, such as a spinal cord stimulator.
Thanks for the great information, guys. Even I learned some good stuff today. Remember to follow along at FortWayneSmallestWinter.com.